Let's get to this discussion. Floods bring immediate devastation, homes destroyed, crops lost and families displaced. But as the waters recede, another danger begins to emerge. Across parts of southern Africa, recent flooding has created the perfect conditions for a surge in malaria infections, threatening already vulnerable communities trying to rebuild. To unpack how disaster response systems can prepare for this hidden health risk, we're joined by a project manager at the University of Pretoria's Institute for Sustainable Malaria Control, Dr. Taneshka Kruger. Dr. Kruger, thank you for your time and for joining us this morning. So, given the severe rainfall and flooding in early 2026 across Mozambique, Malawi, Tanzania, Zimbabwe and Zambia, as well as South Africa, what would you say is the current assessment of the malaria outbreak risk in these regions?
Good morning, Katlego, and thank you so much for having me. So yes, we find that these severe flooding instances, change in climate, etc., they have potential health impact, malaria-related impact. So what happens is when this flooding comes, you find that there's instant risk to people. There is impact on their lives, their livelihoods, their homes, the infrastructure, etc. But what happens when those flood waters start receding? We find that these pools remain behind. These pools are perfect breeding habitats for mosquitoes that can carry malaria. In an endemic area, we find that these mosquitoes then can pick up parasites. If the temperature is right, these parasites can develop in these mosquitoes, and we find that malaria transmission can possibly increase. And this, of course, happens weeks after the original flooding took place, where all this infrastructure and other challenges came about.
So, Prof, I mean, you've just started in unpacking just the variables around this. Just talk to us with regards to specifically the influence that the breeding and the proliferation of malaria vectors in the SADC region really has. I mean, you started with saying that those pools of waters may then have bacteria that then you would find the mosquitoes that are most likely then to spread malaria across in some of these regions. Just unpack for us really that proliferation of the malaria vectors.
Okay, so just a bit of a correction there. So it's not bacteria, it's parasites. So
Parasites.
For malaria,
Thanks,
no
Doc.
problem. For malaria, we find that you have three important organisms. We have the host, which is the human, the mosquito, which is the vector, and then, of course, the parasite that causes the disease. So in these cases, as I said, these pools are perfect for mosquito habitats. So the mosquito will go and lay her eggs in these pools. The mosquito, the eggs will then hatch, forming a larvae, which then live in the water pool, and they then eventually become a pupa, which you find the adult mosquito, moving out of. And when when the temperature is perfect, when humidity is perfect, we find that the parasite, which is also then found in the malaria endemic area, the parasite then is taken up when a mosquito bites an infected human. The parasite is taken up during that bite, and it develops further in the mosquito. And if the temperature is right, that development can finish. And then when the mosquito bites another human again, it technically then carries over that parasite to another human, which then can lead to malaria.
So, Doc, what are the challenges in implementing effective malaria control measures during and immediately after flooding events?
Okay, so during, we find the major challenge is infrastructure. How do we get our teams who spray these houses, who follow up cases, etc., how do we get them to these villages? We also find that because of the rain, they cannot always spray, the inside of houses. They cannot get to the villages because of the water levels, and they cannot spray, which is the backbone of the South African malaria control strategy, is spraying the houses. What we also find is the people, when they start seeing symptoms, they might not be able to access clinics. They might have trouble getting to clinics, where they, in many cases, already had challenges getting to clinics fast enough when they suspect that they have malaria for rapid diagnostic and treatment. So now with the water levels being there as it is, we cannot get to the people. We cannot, do the spraying. We cannot do larviciding, which is spraying of the water habitat where the larvae are. And we also find that the people who have malaria, they might not be able to get to the clinics to get the treatment they need to.
So then what's the role of local communities as well as health systems in early detection and prevention of malaria during these high-risk periods?
Okay, so these communities, it's very important to make them understand what malaria is, how they can prevent themselves from getting malaria, and what to do, if they think or if they suspect that they have malaria. And therein lies the challenge. We need to strengthen that communication to the people. We need to ensure that they can adequately prevent themselves from getting malaria. And the challenge there is many of these people in these poor rural communities that are mostly affected by, for example, these floods, and then, of course, the disease malaria, is the fact that they do not have the funds to to use basic prevention techniques to protect themselves. But by constantly reminding them, listen here, if you have symptoms, if you have fever, intermittent headaches, and you have these, a feeling of malaise, sore muscles, etc., get to a clinic as soon as possible. So it's just about strengthening that message to ensure that they know what to do in case they suspect they have malaria.
Since the threat spans multiple countries, how important is regional coordination in managing and reducing malaria risks, and what efforts do you know that are underway in order especially to enhance cross-border collaboration?
Okay, so you are so right. Malaria does not know borders. It doesn't. Mosquitoes don't carry passports. They move into an area and they can then transmit the disease. So what happens when we find, in many cases, and South Africa is a good example of this. Let me start here. In South Africa, our malaria endemic areas are Limpopo, Mpumalanga, and KwaZulu-Natal. But it's in the northeastern parts of these provinces because that is where it's the best conditions for malaria. But these provinces in those regions, they border on Zimbabwe and Mozambique, two areas which are high-risk malaria areas. And we often find that people come across the border, they have the parasite, they carry the parasite, and our mosquitoes can then pick up the parasite from them and introduce the parasite to someone else. So cross-border collaboration is very, very important. And what we find, our malaria control programs in the provinces, they work closely with their counterparts in these border areas where they do screening of people coming into the country. And so they screen, they check for malaria in these people. And if malaria parasites are picked up, they are immediately treated to ensure that they have, that they're safe when they come into the country and there's no risk of that disease then being carried over to someone in South Africa. So cross-border collaboration is very important. And there's also the whole thing about leadership. The people working in these programs, they need to understand the whole impact that cross-border collaboration can have on malaria. So they need to know about reading data, understanding the challenges in an area when it is raining, when there's an increase in the rainfall, when there's an increase in the temperature. How will that impact on people? How will that impact on the prevalence of malaria? They need to understand that. And without being able to understand how to read that data, how to do surveillance in advance to make sure that they are prepared for something like this. They need to understand all these things, and they need to know that speaking with your counterpart across the border is so important, because it really is something that impacts on our malaria cases, is imported malaria. So yeah, cross-border collaboration, very, very important when it comes to malaria. Without it, we will not be able to get rid of malaria in the Southern Africa region.
So essentially, Doc, you're saying that if this is not contained, somebody sitting in Gauteng or the Western Cape or the Eastern Cape cannot necessarily say they are safe from malaria because they are not bordered to provinces such as KZN and possibly people that could be coming in from places such as Mozambique.
Yes, so what we find happens is when people move across the borders into our malaria endemic areas, or even people from our malaria endemic areas, when they move into, say, Gauteng, or they move into the other non-endemic provinces, we find that if they're carrying the parasite and they start showing symptoms about 14 days after, being infected, they might be in, let's say, for example, Gauteng. And at that point, if they start showing symptoms, Gauteng hospitals or the Gauteng clinics need to take up that patient and treat that patient. Thereby, it becomes a Gauteng case, even though it did not originate in Gauteng. So people living in these non-endemic areas need to understand that they are not totally malaria risk-free. And I'm not saying it means that they now must be, on alert that they could possibly get malaria. It's just a case of being aware. Know that malaria is still in the country. Know that if you travel to a malaria endemic area, that you need to protect yourself. Know that when you come back and you have these symptoms that you think might be malaria, when you go to a doctor or to a clinic, ensure that you give them your travel history, because then doctors will think, I need to look for malaria. So it's not just a case of people coming across the border or from malaria endemic areas into these provinces. It also has to do with people living in these provinces and traveling to a malaria endemic area. So we need to make sure that we send out these messages, that people understand in malaria endemic areas, malaria non-endemic areas, that malaria can be prevented. Know your symptoms, know what you need to do should you suspect that you have malaria.
Lastly, Doc, and very quickly, the Windhoek Declaration of 2018 was aiming for a malaria-free region by 2030, and that being SADC. What do you think is the progress there? Are we edging anywhere closer to reaching that 2030 objective?
I believe we are getting closer, but people must remember there are many challenges, and it's different countries with different malaria risk. There are different levels of control and or elimination. So there's a lot of factors that one needs to keep in account. From my experience, I know for a fact that these country control programs are working very hard. They're trying their best. They're looking at data. They are strengthening their surveillance. They are pushing vector control. They're pushing case management, etc. And they're doing things right. But they're doing it with what they have. They're doing it with limitations within their areas, and they're making the best of what they can. Will they reach it by 2030? I would love to say yes. I cannot say if it will be definite. I would like to say yes, and all I can say is that they must just keep doing what they're doing and take on additional things like leadership training, making sure that they continue sending out messages to people living in these areas to just ensure that everybody contributes toward the fights against malaria, because it's not about just doing one thing. It's not about just controlling the vector. It's not about just telling people about the disease.
Right.
It's about taking all these factors and putting that together, looking at all the tools, all the technologies, anything to get to that point. So the question again, will we get to it? Like I said, I hope we do. I think we have the capacity to do it. It's just there are limitations and a lot of things that need attention for us to get to that point.
Dr. Kruger, thank you so much for your time this morning. Certainly quite concerning, but I think a lot of important nuggets that many South Africans and those beyond our borders can take with regards to ensuring that they look out for those signs of malaria, especially after high flooding and heavy rains that we are currently experiencing.